Healthcare delivery. Our healthcare system in the United States is complex and it undergoes significant changes all the time. There are regulatory agencies that help shape healthcare delivery. These agencies provide standards and guidelines for how healthcare facilities should provide quality care. Despite the best efforts of medical personnel to contain expenditures, healthcare costs continue to rise. We also have a sufficient number of individuals that do not have health insurance. They have limited ability to pay for prescriptions, or they have no access to health care. The Patient Protection and Affordable Care Act was intended to improve healthcare quality, and it was to lower costs and increase access to care. This has not all happened yet, but the Patient Protection and Affordable Care Act did expand eligibility for the Medicaid program to include all adults whose income is below 138% of the federal poverty level. The program also banned lifetime caps on insurance benefits, meaning that there was no such thing as a maximum payout amount. This act did provide coverage to Americans who were unable to obtain health insurance due to pre-existing conditions. Yet, there are still many people in the United States that don't have health care coverage because some cannot afford the insurance premiums that are available on the marketplace. Each state of the United States regulates its own healthcare within its borders. Various organizations employ managers and directors to ensure that the healthcare policies and the procedures are compliant with state and other regulations. As nurses, we are responsible for complying with the policies and the procedures of the organization. Currently, 1/3 of each state's budget is allocated to healthcare costs. Each state is allowed to interpret the federal definitions in a way that the state feels appropriate depending on their population and their economic times. And the states can regulate how the funding for Medicaid is dispersed, because Medicaid dollars are administered at both the federal level and the state level. Many client care facilities are accredited by an outside organization. This is to assure that policies and procedures are in place to maintain quality healthcare services and safety of the client population. Accrediting organizations develop operational standards, policies, and procedures for everyday practices. Examples are environmental policies for the institution, human resource department, client safety initiatives, and documentation. The Joint Commission, which is a nonprofit organization, accredits healthcare organizations in multiple types of settings. The settings can range from inpatient hospitals to pharmacies. Accreditation visits by the Joint Commission consist of documentation and policy review measures, observations, and interviews with administration and staff members to ensure that there is quality and safe patient care, and to identify areas that could use improvement. The Joint Commission surveyors provide guidance on how to change and improve the healthcare practices to increase and enhance the client outcomes within a specific facility. Full accreditation by the Joint Commission is valid for 3 years. Facilities like hospitals and long-term care that seek accreditation must meet the standards outlined in the Joint Commission's manual for the service in which the facility provides. Specific standards apply to each level of care. The Joint Commission also annually publishes National Patient Safety Goals. These goals are based on the current client safety issues. This is published at the Joint Commission's website. Specific National Patient Safety Goals are for each type of setting. It can be ambulatory, behavioral health, critical access, home care, hospitalization, office-based surgery departments. If healthcare facilities report any major issues, the Joint Commission will publish a Sentinel event alert. A Sentinel event is an event that has resulted in a client's death or harm that is determined to be permanent or severe. Examples might be administration of a blood product and doesn't match the correct blood type for the client, an infant death, a surgical procedure that is performed on the wrong extremity. When a Sentinel event occurs in an organization, an immediate investigation happens to identify the root cause and prevent any reoccurrence. The Joint Commission will then partner with the organization to help develop practices to avoid the problem in the future. The American Nurses Credentialing Center has developed 2 programs, the Magnet Recognition Program and the Pathway to Excellence. These programs are designed to recognize quality nursing practice. The Magnet Recognition Program is a program recognizing healthcare organizations that provide excellence in nursing care throughout their facility. The Pathway to Excellence program, its designation is to healthcare organizations that demonstrate a commitment to providing a healthy workforce for their staff. The Pathway standards focus on factors that affect nurses in the workplace, things like turnover rate, engaging in the workplace decision-making, productivity, job satisfaction. Acute care facilities use, like a hospital, short-term stay, they use hospital consumer assessment of healthcare providers and systems, also known as HCAHPS. This is to measure the client's satisfaction with the institution. The HCAHPS tool uses a broad range of very standardized questions that hospitals can use to compare the way they operate and their outcomes against their competitors of the same size institution or a nearby institution. Healthcare clinics use the Press Ganey survey tool. This tool is used to evaluate the healthcare delivery as well as the patient or client satisfaction. The Press Ganey survey for the clinic differs from the HCAHPS survey for the hospital in the sample base that is measured. The clients who receive and are selected to receive the survey. Also, the time in which it is administered differs, as well as how it is delivered. Federal Medicare program qualifications are: the client must be age 65 or older, younger than age 65 with a disability, or any age with end-stage renal disease. Medicare consists of 3 parts, and they're all separate. It is A, B, and D. Each of these parts covers a specified area of the healthcare system. Part A is for hospitalization, skilled nursing facilities, hospice care, and some home health. Part B covers doctor services, physical therapy, occupational therapy, and some home therapy. Part D is for prescription drugs. The other system for the government is called Medicaid, and its qualifications are for individuals that are less than or older than 65. The individual must meet the requirements based on income in relation to the poverty level. Medicaid is jointly funded and administered by the state and the federal government. The income criteria needed varies from state to state. The Children's Health Insurance Program, also known as CHIP, this provides health insurance for children who may not meet the Medicaid requirements, but yet need health coverage. The federal government provides matching funds to the state to administer this program. Health insurance coverage that is not provided by a government agency is known as private insurance. This is the insurance provided in a benefit package by an employer. The company pays a part of the cost and the employee pays part of the cost. In private insurance companies and the Centers for Medicare and Medicaid Services have adopted diagnostic-related groups. This was designed to help control healthcare costs. An individual that is covered under the Centers for Medicare and Medicaid or reimbursed under the diagnostic-related grouping structure is coded into a specific diagnostic-related group. It is then based on age, sex, and primary diagnosis when they are admitted, as well as 25 additional diagnoses and procedures. The Hospital-Acquired Condition Reduction Program. This links Medicare payments to healthcare quality. This decreases payments to facilities that have poor medical outcomes related to 5 specific hospital-acquired infections. This means that the hospital will receive less reimbursement monies for poor outcomes than hospitals that have good outcomes. Types of hospital-acquired infections are central line bloodstream infection, catheter-associated urinary tract infection, surgical site infection, including the colon and hysterectomy, methicillin-resistant Staphylococcus aureus bacteremia, and Clostridium difficile infection. Hospitals that have poor outcomes, or when patients get one of these types of infections while in the hospital system, the hospital will receive no funding for providing care to this individual. All of these are considered as nursing preventable. Each of these requires specific infection control policies. Resource utilization groups is a payment system used only in the long-term care setting, so nursing homes. There are 7 major categories that are used. You have rehabilitation, extensive services, special care, a clinically complex, impaired cognition, behavior problems, and reduced physical functioning. Any facility that is reimbursed by Medicare or Medicaid is required to conduct an assessment of the client's needs at various intervals. This is to be done upon admission, quarterly, and at discharge, as well as whenever the client has a significant status change. In addition to the diagnosis at the long-term facility, the minimum data set assessment evaluates information like the client's cognitive status, need for assistance with activities of daily living, the number of treatment or therapy that was provided. This assessment determines how much the Centers for Medicare and Medicaid will reimburse the facility for the services that are provided to the client. In order to manage resources, it needs to be measured and monitored the quality of the healthcare service that is delivered to the clients. The Centers for Medicare and Medicaid developed a concept of managed care. Case managers, routinely nurses, were employed to review the care delivery to clients in acute care setting and facilitate the transfer of clients to an appropriate level of care, either in the original facility or to another level facility. Because of the managed care movement, many of the healthcare plans also now require pre-certification of services needed. Disparities within the healthcare system relate to inequalities that are far beyond the race of an individual and their ethnicity, because inequalities exist throughout the United States and the healthcare system, looking at social, economic, and environmental differences. Each of these affect an individual's health status. Social detriments of health. This affects the health of an individual as well as the population. Individuals are born into social detriments of health conditions that are in the environment where they live. These conditions can affect their daily life and eventually their health. Nutrition and exercise are major influences on an individual's health and are vital factors in preventative healthcare measures. For economically, we look at stability, education, social and community, the neighborhood, and the environments that have buildings, as well as the health and the healthcare. Because of the healthcare services that are lacking in many areas, we have a role in nursing called the public health nurse. The public health nurse attempts to close the gap whenever there is a social determinant of health, meaning that there's not education, there's not close clinics to where these individuals live. In the public health setting, nurses care for individuals and communities, and they try to improve the health of the entire population. These nurses will provide educational information in communities, clinics, and schools that address healthcare concerns and environmental issues that are specific to that area of population. In a primary care setting, there is a primary care provider. This individual can be a physician, a nurse practitioner, or a physician's assistant. And this individual can screen the client and treat them for a routine illness, tonsillitis. They also promote health and they help prevent disease. There is core care coordination. This is where it occurs, is within this setting. So the primary care provider coordinates any referrals, treatments, and screenings, and their goal is to help avoid any duplication of healthcare measures. The community care setting, this focuses on preventive services. This is providing care to individuals before they need to be admitted to any facility. This works with the population within a specified area. The goal in community care is to educate the community to have a better diet, exercise, and use preventative care measures to help them maintain their level of health and wellness. The acute care setting, this is when an individual has an acute care illness, considering an appendix, so they have appendicitis. This requires treatment in an emergency department or an overnight stay in this acute care setting. It's routinely a brief or short admission. The goal is to treat and stabilize the patient. These acute care facilities have an emergency department and they are able to provide diagnostic services. Oftentimes these facilities can perform complex surgeries, they have intensive care units, and some of these facilities may have a pediatric, an obstetric, and a gynecological unit. Your long-term care facilities, these care for individuals who do not need specific nursing skills, dressing changes, or tube feedings, but they need somewhere to live. Oftentimes, these clients require more care than a caregiver feels able to provide at home, or they need 24-hour care. Most of these individuals require some level of assistance with their activities of daily living, which include things like bathing, dental hygiene, feeding themselves. A skilled nursing facility can also be known as a nursing home or long-term care. It may provide short-term rehabilitation when you think about occupational or physical therapy. These facilities may be able to provide limited therapy, IV therapies, wound care, maybe respiratory care treatments. When individuals are not ready to go home to take care of themselves independently and meet specific requirements, they can be admitted to a skilled nursing facility for rehabilitation for multiple weeks until discharge. Long-term care hospitals specialize in clientele who require hospitalization for a long-term illness. Patients that have been in a car accident and they're badly injured, may have severe burns, may be on a ventilator. Usually these kind of needs they extend past the acute hospitalization period and begin when the patient or client is stable but still requires health care beyond home care or skilled nursing care services. A long-term care hospital is also called LTAC. This provides a higher level of care on a long-term basis. Assisted living provides services for individuals who are basically independent in living, but choose to live in a community setting for some assistance with some part of their daily life. Hospice care is provided to clients when a health provider has determined that the individual has less than 6 months to live. The client and family with the health provider decide the goal of care is not to treat or cure the illness, but the goal of care is to provide comfort and support for the client and the family. Palliative care is not the same as hospice, but often they get confused. Palliative care services is also known as supportive care. This provides services that help the clientele feel as comfortable as they can during their illness. The goal of palliative care is to promote pain relief and comfort during their illness. Respite care may be provided by some hospice services as well as some insurance companies. Respite care is for the caregiver. So respite care provides care for the client to allow the caregiver to have a break from the responsibilities for a short period of time, for vacationing, to travel, or to just remain at home and not care for the family member or the loved one. With home care, this involves having either a nurse or another health provider come into the home and help deliver services like maybe activities of daily living or medications. To work effectively and collaboratively, Healthcare providers need to understand the other team members' roles within the healthcare team. There needs to be competence, cohesiveness, and cooperation, communication, and coordination that leads to the team working in collaboration to provide care to the client. When the team collaborates and communicates within each other, it can also decrease anything duplicate happening to the patient in their provision of care. Your advanced practice registered nurse, often known as a nurse practitioner. This is a registered nurse who completed advanced education in a specialty and passed an associated certification exam. An advanced practice registered nurse can be a primary care provider who, by their licensure, can diagnose and treat clients as well as write prescriptions and requests for consultations. The APRN role varies in the United States from state to state. A case manager, this individual provides services and care coordination for the client. The case manager may be a nurse or could be a social worker. Case management's goal is to collaborate with the members of the healthcare team and the client to make sure that the treatment plans meet the needs and also provide quality and cost-effective healthcare. Dentists have a doctoral degree from the School of Dentistry, and they also pass a licensure exam. These individuals diagnose and treat injuries in the oral cavity. Anything that involves teeth, gums, jaw. These individuals are an integral part of an interprofessional healthcare team, especially as clients begin to age and get older. Dietitians have a bachelor's degree. They have to pass a certification or a licensure exam. These individuals advise clients about healthy food choices for nutrition, to manage the weight. They recommend therapeutic diets to treat specific medical conditions, like a heart patient that needs a low sodium diet. The licensed practical nurse completed a state-approved program and passed the NCLEX PN. The LPN programs, they vary by state, but routinely they are 12 months long and include classroom learning as well as supervised clinical education. The naturopathic physician completed a 4-year program at an accredited naturopathic medical school. Some states require this physician to pass a licensure exam. These individuals are complementary health practitioners. They specialize in treating clients by prescribing natural methods, like a chiropractor. The occupational therapist has a master's degree or a doctoral degree, and they also have a licensure examination that they passed. These individuals will provide care to assist the clients to either recover or develop new skills to maintain the activities of daily living and return to work. The emergency medical technician completed an educational program that is 1 to 2 years in length. They also passed a certification exam. A paramedic does have a higher level of education and skills than an EMT, and they typically hold an associate degree. The pharmacists have a Doctor of Pharmacy degree, and they pass 2 licensure examinations so they can practice pharmacy. These individuals prepare and provide medications that are prescribed by a healthcare provider. They double check for interactions with other medications, and they also educate individuals on how to take the medication. The physical therapist has a master's degree and has passed a licensure examination. These individuals provide services to assist the client to recover from any injury or illness. They work to help clients improve their movement and alleviate pain. The primary care or physician completes a bachelor's degree and 4 years of medical school, and then they pass a licensure exam. If they want to specialize, they need an additional 3 to 5 years in a residency program. So depending on specialty like surgery or internal medicine or cardiac, then it will determine how long the residency program is. A physician's assistant has a master's degree, and they also have passed a licensure examination. These individuals work under direction and supervision of a primary care or a physician. Yet these individuals can treat, diagnose, and prescribe medications, lab, diagnostic tests, and treatments. The respiratory therapists have either associate or bachelor's degree from a program that has been accredited in respiratory care. They also pass a licensure to practice in most states. These individuals treat clientele who have chronic or acute diseases of the lung, like chronic COPD, chronic obstructive pulmonary disease, or pneumonia. The registered nurse completes a nursing program that has been approved by the State Board of Nursing and passes a national licensure exam, the NCLEX RN. State boards of nursing operate under the guidance that comes from the National Council of State Boards of Nursing, or the NCSBN. They assist RNs assess clients, provide and evaluate care based on that assessment, and collaborate with the interprofessional healthcare team to help meet the client goals. A registered nurse will provide education, administer medications, perform treatments, and operate various medical equipment. They may oversee or delegate to licensed practical nurses as well as assistive personnel. A social worker has a bachelor's or a master's degree, depending on their field of work, and they also pass a licensure examination. Assistive personnel are nurses' aides who assist the healthcare team. They can become certified by completing a brief state-approved course of study and then passing a certification examination. They can work under the supervision of a registered nurse or a licensed practical nurse, and this nurse can delegate tasks that are appropriate to the assistive personnel.